Hi, Dr. Lamoreux. How are you?
I am good. How are you?
Welcome, welcome. I am very excited to talk to you about this topic, depression and gut health, because not only are you a naturopathic doctor, but you bring a counseling background. So tell me a little bit about that.
Yeah, so during my training as a naturopathic doctor, I was more and more seeing how big of a role the mind plays in our physical health and the mind-body connection. And ultimately, somewhere along the way, I decided to get trained as a therapist, as a counselor, so that I could feel really confident in having a pulse on what components of this are psychological that are feeding into depression, which components are medical that we can address from the physical standpoint. And so I feel like that's been really helpful for me to address
Yeah,
both. And I really encourage people to address both because you're going to get better results. You know,
yeah,
it's like depression's both a physical and a mental illness.
100%. Yeah, it's super exciting. You're probably one of the few naturopaths in the country with a training in both, which is very cool. And so when you come in or a patient comes in to see you, with a complaint of depression and simultaneous, gut symptoms, like where do you go from there? Like what is the next step typically?
Yeah, so obviously the first step is getting a good history, kind of getting an understanding of like where they've been, what they've tried, like what they've learned about themselves already.
Yes.
Um, and then going from there. And, as far as talking about the combination of depression and gut health, those have come hand in hand in many, many cases.
Yes.
Um,
Yes.
and I think a lot of people are becoming more aware of like IBS, for example, like having like this connection with like mental health. And
Mhm.
so, and even if someone doesn't have gut symptoms and they have depression, I'm looking at that as well.
Yes. Yes. Great. Yeah. And we have so many good diagnostics now, right? I mean that obviously you bring to bear a lot of clinical experience, but the diagnostics are kind of, instructive, I find, right?
Absolutely. So we make use of comprehensive stool tests
Mhm.
that look at a number of things. They look at the health of your good bacteria. We all have bacteria in our gut that support us. They help with digestion. They actually play roles in regulating our mood, like all kinds of stuff.
Yeah.
And so we have tests that look at that as well as are there any microbes, bacteria, yeast, parasites, like those kinds of things that don't belong in the GI tract that could be causing problems.
Yes.
And then, of course, digestive function, like how well are you breaking down and absorbing your food?
Yeah.
And so we have some tests that we make use of. That's one of the things I lean on pretty heavily when I'm evaluating a patient like this,
Yeah.
because there's so much here, and I can say so much about
Yeah.
all of
There's
it.
so much. Right. Right. Because depression is really, in all the recent research, is kind of being taken out of this model of being purely neurochemical, right? There's so many other factors, right? We could go on for an entire day on this, but what are the findings typically you see? How do you explain this connection between the gut and depression?
Yeah, so there's a lot of components to it.
Yeah.
So I think one component that people understand pretty quickly is if you have impaired digestion for any reason, you are not going to be able to absorb the nutrients that you need to
Hmm.
for your body to function.
Yeah.
And that very quickly can impact your nervous system, impact your brain, impact your mood,
Yes.
if you don't have those nutrients coming in. And we see nutrient deficiencies all the time when people have impaired digestion. So I
Yeah.
think people kind of intuitively understand that. And so
Yeah.
that's kind of item number one.
Yep.
And then a lot of people, I have started to hear that the majority of our neurotransmitters, for example, serotonin, are actually made in our GI tract
Yeah. Right.
with the assistance of some of these bacteria, good bacteria.
Yes.
And because of that, like again, having good bacteria and the correct amounts in our GI tract, and then not having infections with other bacteria interfering with that,
Yeah.
that drastically affects our neurotransmitter levels and how our body is able to use neurotransmitters. So
Right.
that's another big component.
Big one.
Um, Another component that I would add to that is like the majority of our immune system actually is housed in our GI tract.
Hmm.
And um, And when I start to talk about this, I think most people can relate. When you've been sick, if you get like the
Yeah.
flu or a COVID, a lot of times you actually feel depressed. Like there's a lot of
Yeah.
overlap between
Yes.
how you act and you feel when you are sick with an active
Mm-hmm.
infection.
Mm-hmm.
And and so there's this immune system inflammatory component to that.
Right. It's big. Yeah. Yep.
And so what we can see is if that gets activated in the GI tract, if there's something off with your immune system because maybe your immune system's trying to clear like a bug
Yes.
that you picked up because you got food poisoning. And then, ever since, like there's this bug that's hanging out there that's
Yeah.
interfering with your immune system, interfering with your neurotransmitter
Mhm.
production,
Yep.
interfering with your digestion. That's this whole cocktail that's
Yeah.
gonna
It's all linked.
affect your mood. Yeah.
Yeah. Yeah. It's really exciting. It's exciting stuff. There's so many spokes in the wheel, I like to say, and it's fun to talk to you about it. I've learned a lot from you today. So thanks for chatting. It's been
Yeah.
great. Thanks.
Perfect.